Yep. And I see we're on live on Facebook, so.
We are live. You can see it?
Yes, I can see it.
Great.
Okay, so it's 7 o'clock on the dot, so I think we'll go ahead and get started tonight. We have a good number of attendees on the webinar, and then we're also broadcasting this on the Friesian Horse Association of North America's Facebook page live. So thanks to everybody that's tuned in here. I know we have some guests from the United States, Canada, and then also some guests from Europe too as well. So that's wonderful. And our presentation tonight is on laminitis, which is a really difficult disease to understand from a technical standpoint for some owners. And it's also a disease I think not very many owners have had an experience with. So our hope is tonight that you'll learn something that can help you be more proactive, maybe with the care and management of your horse, both diet-wise and hoof care-wise. And then if you ever find yourself in the unfortunate situation when you're dealing with a laminitis episode, that you have the wherewithal to seek treatment early, and you can understand some of the treatment options and prognoses for this disease. So tonight our presenter is Dr. Taylor. She's an associate professor at Auburn University in Alabama. She is also an equine podiatry veterinarian, which is a very specialized field, and I think it's a very worthy field. As they say, no hoof, no horse. Dr. Taylor is working really hard to educate horse owners on the early signs of laminitis in order to prevent this painful disease. Her passion is really equine podiatry, so she may tell you a little bit about her background here when we get started, but she's very interested in the professional study, care, and treatment of the equine foot, and she was actually inducted into the International Equine Veterinarian Hall of Fame for her research and work in the study of equine podiatry. Her interest lies in discovering methods to readjust the load of the foot to promote healing, and also understanding the mechanics of blood flow, weight distribution, and local atomic structures of a healthy foot. So we're very excited to have her tonight. Thank you so much, Dr. Taylor. And then we also want to talk real quickly about our sponsor for tonight's webinar. The Fenway Foundation has come on board as the sponsor for FANA's educational webinar series, and we're so excited about that. A lot of you in the audience probably know about the Fenway Foundation, but for those of you who might not, some quick background on them. The Fenway Foundation for Friesian Horses is a nonprofit corporation that's created to preserve and enhance the longevity and quality of life for Friesian horses by accruing pertinent equine and more specifically Friesian information to educate the public and offering assistance to Friesian horse owners throughout North America. They were founded in 2010. And their focus is really in three key areas. One is equine healthcare and maintenance. So owners can call in and basically ask questions. They get emails all the time. Hey, I have this issue going on with my Friesian. What am I kind of dealing with? And they have a veterinarian that works with them specifically on the foundation to answer some of those questions and to get owners resources. They also promote and assist in genetic research studies, and they do a lot of Friesian horse rescue. And so they develop some amazing foster facilities and rescue facilities across North America, and they save and adopt and rehabilitate Friesian horses in need of assistance. And most of us would not think that valuable horses like Friesians would find themselves in circumstances requiring rescue or surrender, but it does happen, and probably more than most people realize. And it's a wonderful resource for the community to get these horses the help they need. The foundation also works on creating alliances with equine experts in both North America and Europe to proactively work towards the preservation and protection of Friesian horses throughout a variety of research projects. This year they established a rescue and research fund to fund genetic research so that resources out there for universities and veterinarians that want to conduct research to assist the Friesian horse in their longevity efforts. They are a charitable organization, and so this is kind of something I want to highlight here. They do not probably promote themselves enough, in my opinion. They do amazing things for this community. They have a 501c3 tax status, so any donations you make to the foundation are tax deductible. But there are many ways that you can assist the foundation other than donations. Our community obviously has some incredibly talented people in it, and they're people that have a passion for the Friesian horse. So depending on what your talents or ability are, there are many ways that you can assist them in their important work. So if you're interested in doing that, I encourage you to go to their website, www.fenwayfoundation.com, and you can learn more about what they do. They have some horses up for adoption right now that are looking for homes, and then you can also find links if you wish to donate. So thank you so much to the Fenway Foundation for their support, continued support in our educational platforms for the Friesian horse community. So with that, I'm now going to turn it over to Dr. Taylor. I'll stop sharing my screen so she can start sharing hers, and she will help us learn more about laminitis. Oh, I also, while Dr. Taylor's pulling up her screen, I want to mention to the audience, we have some questions that have been sent in already, but if you have a question during the webinar, we're going to pause at a few key points here. So if you have a question, you can feel free to type it. If you look at the bottom of your screen, you'll see a tab that says Q&A. So you can click on that and you can send a message. Or if you want to send it into the chat box, you can do that as well. So we will try and take your questions as we go along here.
Okay, are we ready to start? Can you hear me?
Yes, ma'am, we are ready.
Okay, do you see my screen now?
Yes, we can.
Okay. All right, so I thought we would just start, just so in case people are not familiar with the internal anatomy, we're going to start with kind of an x-ray, and this is actually a 3D model of the internal anatomy of the foot, and it's just important for you to know kind of where I'm showing you these microscopic images from, okay? And we're going to talk about how different things in the horse's environment and different common problems with the Friesian horse and some other breeds similar to Friesians or have similar problems. They're not similar to Friesians, but they have similar problems. So essentially, we just want to look at this. This is obviously the hoof capsule. Can you see my mouse?
Yes.
Okay, so the hoof capsule, and then this is the coffin bone or the distal phalanx, also known as P3, the third phalanx. This is the second phalanx. A little bit of the second phalanx comes into the hoof capsule. These are the collateral cartilages in the back, and then this green is the digital cushion in the back part of the foot. And this is from a foot that has a fairly wide frog. The bigger and wider your frog is, the bigger your digital cushion is. And it's a hypothesis of mine that these bigger digital cushioned horses have a better base of support should they get laminitis. They have a bigger, wider heel. And so that internal structure here in the back of the foot can act as a form of support for them. But what we're talking about today is laminitis. And so if we look at this x-ray, this is the 3D image. Now we're going to come over here to the right of the screen. This is an x-ray of the foot. And here the hoof wall is marked with barium on this white line. And then there's your P3 or your coffin bone. And I'm not sure on your screen if you can see or not, but there's actually 2 shades of gray between the coffin bone and the dorsal hoof wall here. Okay, there's 2 shades of gray. The darker shade, this that comes here close to the bone, and you can even see on this foot, it wraps around the tip of the bone. That darker part is what we call the dermis. And it has dermal sensitive lamina. That's where the blood flow is that nourishes the bone. And then out here is you have the keratinized layer, which is the hoof wall, the lighter gray color. And when you look in here, you can see that from the hoof wall out to the bone, out to the hoof wall down to the bone, two really important things. One is that you got about equal thickness of the lighter color and the darker color. Okay, that's the epidermal part and the dermal part of the attachment of the hoof. All right. And the other thing that's real important to remember is that, it's supposed to be parallel. So this front wall is supposed to be parallel to the front of the bone. And what is holding that there is what we call lamina. Okay, and so they're really, it gives the horse more surface area when it has lamina. So there's lamina on the inside of the hoof capsule, and then there's lamina on the outside of the dermis, and they interdigitate. Okay, and so now we're going to start talking about that interdigitation and how it can be affected by obesity, number one thing. Okay, so Friesians are very thrifty. They tend to carry a lot of extra fat very easily. And they have this big crest on their neck. And it's kind of, even on your all's things I was looking at the beginning, it's their trademark, this big, beautiful arching neck, you know. But I think that's indicating that they carry a gene that makes them prone to be thrifty and prone to be most likely insulin resistant. So insulin resistance is very much like type 2 diabetes in people, where when they eat sugar, then their body begins to kick out insulin, and then they eat more sugar, they kick out more insulin, and eventually it's like they don't respond to the insulin. They can't drive all their blood glucose into the cell with that insulin, and so that insulin gets really high in their bloodstream. Okay, and so one of the main causes of laminitis is insulin resistance, high blood insulin, and that comes from their diet. And one of the key things to notice and look for is when they have this very cresty neck. And we're going to show you some pictures, not of a Friesian, but if it's a Tennessee walking horse, she looks much like a Friesian in here. If that crest gets really hard, if that crest has lines in it, that are perpendicular to the mane, like dimples, like a washboard appearance, then that means you're more likely to be insulin resistant. If your horse has like lumpy, bumpy fat on its hips and its butt that look kind of like cellulite on a person, that's an indication your horse could be insulin resistant. So let me switch over to another set of slides here.
Dr. Taylor, while you're doing that, one quick question we have coming in is there on the body condition scale, you know, like at what number, you know, is that something that we would correlate to laminitis risk?
Yes. So most horses, most breeds, we look at anything more than a 6.5 as being obese, getting too fat, and being, see, the fat cells that are laid down when a horse is obese, they are like an endocrine organ. You know, they're not helping the horse, and so they're endocrinologically active. They're increasing, like in humans, if you have belly fat, you're supposed to be more likely to be insulin resistant. In horses, if you have nuchal ligament or a crest, you're more likely to be insulin resistant. Also around the tail head. So fat laid down around the tail head, fat in the crest of the neck, fat behind the shoulders, all of those things are telling us that the horse has a high body condition score. And honestly, I rarely see a Friesian that's a 6 or less. A 6 is supposed to be healthy for other animals, but you don't see Friesians very often that are 6s. They're usually 7s, 8s, 9s. You know, they're usually, because they don't take much feed to remain healthy and fat usually. I'm sure you could start a Friesian, but we wouldn't want to do that. But anyway, let's talk. There's three major causes of the lamina failing that are holding that bone parallel to that hoof wall. Okay, and this little talk was written for vets, but I'm going to try to show you some of the things that I hope will kind of, you know, so scientists say that the pathology, the disease, that means the disease is likely to be well established before you notice that the feet are sore. And so prevention starts with identification of your at-risk horses. Okay, there's 3 reasons they can get laminitis, and we're talking mostly right now about obesity and or Cushing's disease. You may have heard of Cushing's. It's also called PPID in horses. So Cushing's disease can also cause laminitis, and I'm going to show you the actual microscopic images of the lamina when a horse has either obesity and insulin resistance, or he has Cushing's. Okay, now a whole nother deal is when they get really, really sick with a fever. And we're going to talk about that at the end, and how there's a little bit of a unique thing there for the Friesians too. But The far and wide, the most problem they're going to have is what we call this endocrinopathic laminitis, where their endocrine system is causing the problem. And that's mostly insulin, but also Cushing's. Okay, so these are our 3 major causes that a horse could get laminitis. We'll talk briefly at the end about support limb laminitis, where if they get lame on one foot on one side and they're always loading that opposite leg can get laminitis. The other one is this fever, systemic inflammatory response syndrome. That would be fevers, diarrhea, severe colic. They could founder after severe colic. Let's think what else. Retained placenta is a big cause of systemic inflammatory response that can cause laminitis. Acute grain overload, where they've busted into a feed room somewhere and eaten a lot of grain that's high in sugar. We're coming up on hunting season, and I'm going to go to my local hunting stores and put up signs, because a lot of times families that have horses also have a hunter in the family. My boys hunt, and they've got, right now they have in their possession wheat, feed wheat to try to get some dove to come here and put out a dove field, or they'll have corn. It's legal to hunt over corn in Alabama now. I don't know about other parts of the world, but when one member of the family goes and gets these corns and wheats and things and then doesn't tell the horse owner what they're doing with it, or doesn't secure it, or even just puts it in the back of their pickup truck or the back of their side-by-side, and they're going to go put it out in their deer feeder or whatever. But then let's say the other family member's horse gets out in the night and is wandering around the property and comes to this truck or this SUV thing that's got the feed in it and eats that. Well, then you've got a systemic inflammatory response syndrome that's going to cause laminitis. So different things to think about, but right now the biggest one for Friesians to me is this bottom one, endocrinopathic, and we want to get back to that because I want y'all to understand how important their diet is. So the endocrinopathic form, insulin, has a direct effect, negative effect on the lamina that hold the foot together, that hold that bone parallel to the hoof capsule, okay? And so these folks have shown the microscopic anatomy of insulin-induced laminitis in ponies. And so I wanted to show you that. And they did this by giving ponies insulin, and then after they got laminitis, they euthanized them to understand this disease. So it doesn't, so this is what we're talking about right here. I wanted you to see this. So this is these lamina that I'm talking about. And these are on the inside, on the surface of the bone are these. I
don't think we can see what you're showing us. Right now we're seeing that initial presentation that you pulled up, that initial slide. Is that,
okay.
just wanted to tell you.
Oh, dang. Okay, new share. I do new share?
I think you just maybe.
Okay, here we go. How about that?
No, we can see whatever. There we go. Okay.
It's now pink. A lot of pink stuff.
We got it now.
Okay. So what they're showing here is these actual lamina and how they interdigitate. So these on the top, this is the dermal side that's hooked to the bone, and it has these leaves that go down in here in between each of these that are the epidermal side. So this is the hoof side. This is a secondary epidermal lamina. So it's this interdigitation like this, okay, of these lamina together that are holding the bone up in the hoof capsule, this tight interdigitation. And the surface area is tremendous. We have a professor at Auburn whose wife knitted a quilt, or knitted a Afghan that was the size of all the surface area. And I think the thing is 4 by 6. So, you know, it's like 24 square feet of surface area that are available to hold this thing together inside the hoof, around the bone. Okay, and so if you looked at these things, if you popped off a hoof capsule off of a horse and looked inside of it, it would look like the underneath side of a mushroom. Okay, the way there's those leaves in there, and that's what lamina, I think, means in Latin, is leaves. And so the inside of the hoof capsule looks like the underneath side of a mushroom. And that would be it would be these pink leaves that you would be looking at, okay? And then locking into that is the dermal ones that are on the bone, that are adhered to the bone. And so that's how it all holds together. And it's supposed to be tightly connected, like we see right down here. This is one of the secondary lamina, and this is the dermal lamina that comes in between it. But what happens when you get into insulin, you see, is it comes over here to the right side. So in the insulin-induced horse, it starts to change the anatomy internally so that this Velcro is not as tight. So the fact that, I'm sorry, I got to sneeze. I don't have COVID, but at least y'all didn't have to be exposed if I did. But so it starts getting elongated. See how frayed it is? And so it's almost like just taking Velcro and popping it apart. But essentially, you know, the insulin is causing these things to become longer. And they'll actually push the hoof wall away from the bone before the bone ever actually tips downward. So you'll see on some of these horses that come in and get x-rays. So one thing I would recommend, if you have a horse that has wall flares, or he has a lot of rings in his feet and he is obese or she's obese, get some x-rays of the horse before it gets sick. Get some baseline x-rays and see if you've got that nice tight parallelism between the bone and the hoof wall, so that you can know, you know, am I already getting in trouble? Because a lot of this disease starts occurring like insidiously. It's going on, and then all of a sudden, all of these cells that are getting disorganized are no longer strong enough to hold that bone in place, and then it starts to pull. And when it starts to pull, that's when the horse says, ow. He starts walking around funny, but after it already says ow, you know, could be too late on these cases.
So one question, Dr. Taylor.
Go ahead.
How long, this question, I'm trying to read it here. How long will we see a change in radiographs before we see an outward change? Is there a base time period between when a veterinarian could see on a radiograph that there's an issue before we start to see, you know, some outward signs of lameness and things like that?
Okay, so it depends on which type of laminitis we're talking about. Okay, the kind where we talked about a systemic inflammatory response, a fever, grain overload, retained placenta, those horses might have a perfectly normal foot if they weren't also insulin resistant. They would have a perfectly tight normal foot, and they would get painful, and then they would rotate because their disease is different. If you look at this top slide here, you can see how tightly this is so well, the architecture is so pretty and organized. And from the tip of the primary lamina out to here is just this distance, 320 microns. That's kind of irrelevant how far it is. The point is that when the insulin starts kicking, then it turns into this distance. Okay, it turns into these longer distances. And so on this particular situation here in the middle, if that's what's going on histologically, that hoof will be starting to push the capsule away. So as this stuff in the middle here that gets thicker, these lamina get thicker, the bone is in one place, and then the hoof gets pushed away because you just added all this length to the internal structure. Does that make sense? As this internal structure goes from 328 to 485, it starts to push the hoof away.
Right.
Okay, so that you would see, if that's what your poor horse's problem is, you might see that weeks or months before it all just pulls loose and becomes completely unstable, and the horse is very, very sore.
So essentially, by the time we have an outward sign, we potentially have a pretty serious problem.
Right. By the time they're saying, "Ow, my feet hurt," then you're getting into a pretty serious problem, because all of this tissue has nerve endings in it, and so it's pulling apart. Okay, and so essentially, a Friesian is a horse that's very easy to kill with kindness. You feed him too much, and you get him into insulin resistance because you love him and you want him to be happy or she to be happy, and you feed them well, and they get insulin resistant, then all their lamina is starting to do this internally. And if you take an x-ray, you might notice that you're losing your parallelism just slightly, okay, or the wall's just getting thicker. Externally, you're looking at that, you're going to see a flare, a wall flare, okay? Or if you have rings in the feet that are wider at the heel than they are at the front, that's another sign that this is happening. If your white line is stretched, we've got a list of telltale signs down here on another slide. But this is sort of this is a lot of stuff that you probably don't want to look at, but the histopathologists talk about how the tissues bridge, like from one lamina to the other, they'll build a bridge. And then in between the bridges will form these little puddles of fluid that look like little lakes. And then they end up with these little caps on the end of their lamina. So it's just completely destroying the lamina, and it's all because of the insulin. So they're longer primary epidermal lamina. They have increased numbers of tapered ends. They have bridging, and then they have these lakes, these dermal islands and lakes. So it's completely unrecognizable, really, from a microscopic standpoint. So here's where we're seeing that it's actually forming these little lakes in there where you're supposed to have that normal anatomy I showed you in another slide. Here's where you've got all this keratin being laid down at the end on these lamina. They have no holding power to hold the bone in position. Okay. Let's go down here a little bit further. The point is here is there's a potential for reversal of some of this rotation on these horses if you can get the insulin turned down. So as long as that insulin is cranked up, you're going to continue to have all these internal pathology to those lamina that are supposed to be tight, and now they're getting further and further apart, and these gaps between my fingers are being filled with abnormal cells, and then finally it just pops loose and your horse says, ow. Okay, and the bone begins to rotate at that point. But let me just go and switch over just to Cushing's disease for just a minute, because like all breeds, Friesians can have Cushing's disease. In Cushing's, this again is the normal here that we've been showing you. Can you see this normal one where my pointer is? Can y'all see my pointer?
Yes, we can see it.
Okay, that's the normal look. And then the Cushing's horse, here's what's trying to hold your horse's foot together. These spindle-shaped cells, okay? You know, this is the normal, and then it starts they get shorter. See how these are nice long lamina? These get all truncated and short, but then on the tip, you get this like spear, okay? They call that a spindle shape. Now this has hardly any holding power, okay? So your horses that have Cushing's are at high risk for laminitis if they're walking around on a horseshoe that's primarily under their wall, okay? Because their wall's connection looks like this mess. It's weakly connected. If you put all of their support out in their perimeter and the weight of the horse is in the middle and he's sinking down and it's like prying or peeling his wall off, and the wall is not tightly connected. So you got to be pretty careful about a perimeter horseshoe really on either one of these situations. Okay, so these are your prevention by early recognition, your baseline x-rays. So that's what I'm saying. If you see any of these problems, or even if your horse is healthy, it doesn't hurt to have baseline x-rays. Okay, so what are you looking for? Divergent growth rings. That means your growth rings on your hoof capsule, the distance between them is wider at the heel than it is at the front of the foot. That's a telltale sign something's not quite right, because laminitis horses almost always have more blood flow in the back of the foot. The width of the growth ring has got to do with blood flow to that part of the foot. So the wider the growth ring, the more blood flow. If it's pinched at the front, that means there's less blood flow at the front, more blood flow at the back. The other is your dorsal hoof wall has a big flare in it, like a bend in it, okay? Or you see two different angles on your dorsal wall. It's another one. Complaints of white line disease. If people are saying your horse has white line disease, if he's got a tight white line, he shouldn't have white line disease. One of the main reasons that an insulin resistant horse or a fat horse or a thrifty horse like a Friesian would have white line is that he's also got a wall flare. If he's got a wall flare, he might have laminitis. Okay? Somebody's saying he's got to get a bigger shoe. The walls, you know, the foot doesn't get bigger unless it's, you know, the bone, once he's an adult, his bone is staying the same size. And then if his wall is parallel to that, it's coming down the same size for the rest of his life. Unless he gets laminitis and it starts flaring, and then that makes his footprint bigger. So if the farrier's going to the truck to get a bigger shoe, he's got a stretched white line, you need to say, I think I'm going to get some x-rays on this horse. Okay? Obesity, I talk about scaly upper new growth of the hoof capsule. So if at the front of the foot, his hoof growth is real scaly, like it's crusty, that's usually a sign that there's not a lot of blood getting into the front. On any horse that has swelling over his above his eyes, this is supraorbital fat. If he's got like little puffiness that might mean he's got Cushing's. If his foot looks more like a cone, it's just like really cone shaped and, you know, and going out. The cresty neck, which almost all y'all's horses have. Bumpy fat that looks like cellulite or tailhead fat. So here behind here is a mare that's got a crest. Okay, and when you grab this thing, it's hard. And it has lines in it, it has ridges in it that go perpendicular to the mane. Okay, so that's even getting progressively worse once those ridges are there. So here's what I'm talking about. These crests, and then here's this big hunk of fat by the tailhead. That's not how normal. And then this little horse has the wall flare. So she's starting to come in and then it diverges outward. Okay, and that's obviously not the worst one. This one was actually being somewhat managed. So insulin is evil to the horse, okay? And so are the carbs that create it. So carbs in the diet is what creates insulin, hyperinsulinemia. And one thing to think about, the horse doesn't have to be actually insulin resistant to get laminitis because somebody's been feeding him so much carbohydrate that his body couldn't metabolize it all. So his body is constantly kicking out insulin, kicking out insulin, kicking out insulin. And that insulin is still hurting the feed, even though the horse hasn't gone into full-blown insulin resistance. So I call that dietary induced hyperinsulinemia. Okay, somebody that is just constantly feeding the horse too many carbs and the insulin is high, but if you just took those carbs away, that horse's insulin would go right back to normal. Prevention of the endocrinopathic laminitis, recognizing hoof distortions, the flares, the divergent growth rings, and then getting that and document with a radiograph. Implementing dietary changes, pinpointing these horses by annual exams. A lot of your vets, you should ask your vet, is my horse too fat? Because a lot of vets are afraid to tell you because people get mad when vets tell them that, and some vets just eventually give up. You know what? I'm going to give up. Everybody's mad at me when I tell them that. I'm just not even going to mention it. I'm just going to vaccinate the horse, do its teeth, and I'm tired of telling these people his horse is too fat. You know, you just got to say, is my horse too fat? And if it is, you know, learn how to body condition score it yourself. Implement those dietary changes because you're never going to win as long as you've got this hyperinsulinemic, and I call it a hyperinsulinemic laminopathy. A laminopathy means it doesn't hurt yet. It's a pathologic process of the lamina that's happening before it hurts. Okay, and then later when it all starts to actually pop apart and physically traumatically tear, that's when the horse says ouch, and you're getting too far, you know, behind the ball. So we wrote an article about treatment of this sort of laminitis. We didn't have any Friesians in that group. Caught early, a Friesian should respond to that same method. And it's published in ScienceDirect.com, where we looked at the clinical outcome on 14 obese laminitic horses that are managed with a protocol that's done by some of the barefoot industry. So if your horse has either of these endocrinopathic laminitis processes that cause their lamina to look like I showed you on those slides, then a horseshoe in the perimeter is not their friend, okay? Because the connection between bone and wall is weak. And then if you're taking this big, heavy horse and only using the wall to hold him up in the perimeter, it's just going to start to peel it back, okay? And so you got to figure out a way, how can I hold this big, heavy horse from the center of the bottom of his foot rather than from his perimeter, okay? Because his perimeter has become sick by his insulin or his Cushing's disease, okay? And you can get ahead of it if you do that. There's, so this is kind of what one of these cases would look like. So you see the dorsal wall is no longer parallel to the bone, but this tissue in the middle that we looked at earlier that we said is half dermis, half epidermis, it's just one big gray kind of smudge now. but it's not a black line. Like, so it's not peeled loose. So gray means there's tissue in there. It's not air. Okay. If this was a black linear line, that would mean there's air in there. That would mean that the dermal side is popped completely loose from the wall. And that's what will often happen with your systemic inflammatory response. It just lets go suddenly, okay? Because in between these layers of these lamina is something called a basement membrane. And that's the interdigitation between dermis and epidermis. And when you get a fever or the acute grain overload, what happens is that little layer just melts. Okay, these guys didn't change length or get distorted. These guys didn't, they just, the connection just melted and they just slide loose. And in that case, you may see a black line on your x-ray because it physically has separated quickly. But these are the ones, what I'm showing you here on the slide now is what it would look like if your insulin was your problem or your Cushing's disease was your problem. And this x-ray didn't get like this overnight. So you were asking, how far ahead could you see this if you x-rayed it? This one has probably been going on for 6 months, okay, for it to have gotten this thick, 35 millimeters thick. It's supposed, this right here where it says 3.5 centimeters, it's supposed to be 2.0 centimeters on a light bred horse. They really don't have normals for Friesians. That would be a great project to fund, to get normal radiographic parameters of a horse like a Friesian. We don't know how thick their wall is supposed to be. Like on light bred horses, it's supposed to be 20 millimeters thick on an x-ray. On your Friesians, I'm guessing it's probably 25, 26 would be within normal. But here's something, well, we're gonna get to that in a minute. Okay.
I do have a question for you, if I could just
Okay.
I've got a question that come in from Karen a while back when we were talking about insulin resistance. She wants to know, has anyone found that horses with insulin resistance and Cushing's develop chronic progressive lymphedema prior to laminitis developing? So she's asking, is CPL something that is an indicator that laminitis might be coming in a horse that's insulin resistant or has Cushing's?
I don't know about a connection between those two pathologies. I'm not aware of that. You don't have, they might go together if you had the chronic, the lymphedema, but you don't have to have the lymphedema to get laminitis. Okay, the legs may not swell at all. The legs look clean, everything looks perfect on the legs without any edema. But here's I've kind of already talked about this. And the basis is say no to a traditional perimeter shoe if you have high insulin. Okay, because like I've said, the insulin is destroying the connection, and now you're putting all of your weight bearing out in the perimeter, the bony columns in the middle, and it'll just push right down in. Okay, so you're challenging. When you put a perimeter horseshoe on with no support in the center, on a horse that's insulin resistant, you're challenging those sick lamina to continue holding that horse up. You're like giving them extra work to do because you've lifted the center of the foot off the ground. So these are some horses. So this is kind of the trimming that we've done for those light bred horses. We have rehabbed some drafts the same way. I want to skip down here to slide 65 on this. This is just a lot of different ways you can shoe them after it happens, but we want you guys to prevent it. That's going to be the key. But I want to run down here to slide 65. 1 second, because that's where, or 67, we see, we start talking a little bit about the SIRS and how do you prevent, let's say your horse has had a fever, okay? And this is going to be kind of tricky for you Friesian owners, I think. So now let's talk about systemic inflammatory response syndrome. And what do you do to prevent laminitis if you know your horse has had a fever, she has a retained placenta right now, she got in the feed room and ate a bunch of grain and just now found out about it? What are the emergency first aid in that situation? Okay, so all the research shows in that situation is ice. Okay, it is cryotherapy reduces the severity of what's about to happen to the feet because of a systemic problem, an acute systemic inflammatory response problem. So we put the horse in ice. We leave him in ice for 48 to 72 hours. You can even leave him in there 5 days. And when you're cooling those lamina, that basement membrane doesn't melt and come loose. Okay? Now, here's the deal. All of this research has been done on standardbreds and light bred horses. And I have only seen one light bred horse that had systemic inflammatory response syndrome get laminitis at Auburn University in the last 7 or 8, 10 years. Why? Because they ice them like crazy. They're constantly icing these horses. But here's what happens to the poor Friesians. I think maybe their foot is too thick for the ice to cool the lamina, because I think their hoof wall's too thick. And I think that could be why this treatment that's indicated to prevent laminitis for all these light bred horses seems to fail the Friesians. Okay, even no matter how much ice you put them in, they still seem to get laminitis if they were very systemically ill. So that's bad. That's scary. It makes it, more scary, because I know that if I stay up all night with a thoroughbred with his feet nice, he's probably not even going to get laminitis. And if he does get it, he's going to get a mild form of it that I can treat and get him over it. But these Friesians seem to get more affected by systemic inflammatory response syndrome, and it doesn't seem to be as preventable with ice. I have had one Friesian that was iced, that got laminitis, that we did get him over it. But I've had multiple other ones that were iced and they got laminitis and they did not survive. So that's the sad part about this part of laminitis. Again, this is much less common. I mean, it does still happen, and I still would ice them, but I would be so religious about it if my horse. So it's like a bag of ice water slurry on their feet, or you put them in water trough, put them in a horse trailer, stand them in some sort of a bucket, big, large muck bucket on their front feet, muck bucket on smash them in a horse trailer in the cuts of a slant load horse trailer where they can't get out of it, and just keep that ice coming, if they're in your care. But if you go to a hospital, they're going to have them in these sorts of ice bags. And these ice bags, there've been studies that have shown that this is as good as doing, a boot a little bit higher up the leg even.
I have one question, Dr. Taylor, that's come in. If we're at home and our horse suffers a fever, at what degree of fever do we need to consider ice or getting them to a clinic to be iced when we're talking about having a fever like this after a placenta or something like that that's retained?
If that placenta is still in there and that placenta didn't get out in 5 or 6 hours after that mare foaled, then I would get that mare in ice. Fever or no fever. That placenta needs to be out within 5 or 6 hours. If it's been in there 24 hours, she needs to be in ice. 12 hours, probably needs to be in ice, with or without the fever. Okay. And again, on your horses, we know that I think that their lamina don't get quite cold enough to completely prevent it. So they do need good nursing care to get that uterus cleaned up quickly. While they're in ice, be getting the uterus cleaned up quickly. As far as what temperature, it's kind of hard to say. But I would say, over 102 is scary. Especially if it's prolonged. If you've got a horse with 102 temperature and it gets some Banamine, it drops right back down to normal, and you have, that goes on for a couple of days, you're probably okay. But if you're hitting, I'm not giving a webinar right now. Can you guys go outside or not make any noise in here, one or the other? Okay, make no noise. Sorry, guys. So if you are looking at a fever of 103 or 4, I would get them in ice immediately.
Okay.
You know,
Yep.
but 102, I'd probably like be treating it with, you know, call my vet, you know, talk to them about giving Banamine. If it comes down right away with the Banamine, you're probably okay. But when you start looking at 103, 104, I mean, the only thing you're out is your time and your effort and your sleep.
Yeah.
It takes, you have to lose some sleep to keep a horse in ice. But that's the only thing you're out. It's not expensive. It's not going to hurt the horse if you didn't need it. You know, so that's the good thing about it. You're not going to hurt him with it, but you might help him with it.
Okay.
I
I have a question about shoes.
okay.
This question says, a lot of Friesians are shoed with a high heel shoeing. So if you haven't seen that, it's very common in this breed. You know how different breeds shoe different ways. In Friesians, there's a tendency, especially in Europe, probably more so, to have a very high hoof wall. So the heels are very high, the foot is very upright, and a lot of people think that helps the horse move better. So the question is that detrimental to blood flow? Does that hurt a horse that has a issue of laminitis that's onset developing?
Okay, so some veterinarians treat laminitis by wedging horses. Because when you wedge them, you decrease the tension in their deep flexor tendon. So the deep flexor tendon is the thing that's pulling against the lamina that pulls the bone down, because the deep flexor tendon ties in on the bottom of the bone. And so you can wedge a horse drastically and get yourself some slack in the deep, and that'll decrease the chances that that they may rotate further. And some veterinarians use that, you know, exclusively for trying to prevent rotation. So probably, I wouldn't say it would cause laminitis, no. It might cause the heels to contract.
Right, it usually,
somewhat.
yeah, it usually does. So if you had a horse that, let's say, was insulin resistant, an overweight horse, going back to your slides earlier, that might not be helping him because his foot is supported more so by the outer wall.
Right.
Than the frog and all the other supporting systems. Is that
right? So if he's insulin resistant and he was in the shoes that were trying to wedge him up or keep him high, then I would think what I would do is put a porium pad under there at least, to try to increase the surface area in the center of the bottom of the foot if you think you got to stay with that shoe. And he's also insulin resistant. One thing we've done that works really well if they're insulin resistant, or especially in your Cushing's horses that are shod, is to actually put a cast wrap on the hoof, a cast on the hoof itself, not on the hairline, but below, just on the hoof. Put a cast on the hoof that's going to give that wall a hug and a squeeze. Then put the shoe on the cast. Then put the shoe on the cast. So we've had multiple horses that were Cushing's that were in work. We knew their lamina weren't healthy. They had always been shod. They'd never been barefoot. So we wanted to keep them shod. They needed that protection. They didn't have the greatest depth in the bottom of the foot. And so we casted the foot and then put the shoe on the cast for traction. And that's a good way to do it, because that way you're giving that wall a hug and not letting it just be flaring every time the horse loads. So you're just kind of control the wall expansion with a cast.
I have several people asking, do we ice all 4 feet? So if you have a horse that has a fever, would you want to ice all the feet or just the front feet? They're asking that question.
Well, yeah, I mean, yeah, it's better to ice all 4 feet. It's a pain in the butt.
Because you can get laminitis in all 4 feet.
Yes, you can get laminitis in all 4 feet. Of course, the fronts are more prone to more severe pathology because there's more weight on those, we think. But I have seen horses where their main problem is their hinds. And I've got an old friend that did a lot of repro work, and, you know, a very experienced veterinarian. And I don't know why, but he seems to think that those retained placenta horses are more likely to founder in their hinds than they are their fronts. And that's like, why is that? Because the infection's closer to their back feet? I don't understand. I mean, I don't really understand that concept, but that was his observation in practice, is that the retained placenta mares are very likely to founder in their hind feet as well. So if that's your problem, definitely I would do the hinds. Now, what you might want to do is put the fronts in a water trough and use some sort of bag. You know, you can use those dry bags that you go camping with, that you put your camping gear in. They make really nice ice bags. If you get one of the bigger ones for your Friesian, you know, you could get 4 of those dry bags and put them on the leg and then put your ice in that. Would be another way you could do it.
Okay, another question we have is, if we have a horse that has an acute laminitic episode, meaning they have a fever or they've eaten some grain or something like that, and they're obviously off, is it safe to transport them, or does that do more damage to the feet?
Yeah, it's not really safe to transport them. Especially if they're in a perimeter fit horseshoe with no pad in the center. So if you're gonna transport them, because you have to go, if they've still got the fever, you've got to go to a vet, right? But you've got to think to yourself, I'm realize that in hauling this horse, I got to have a really good reason to haul him. I can't get the same quality of care where he's currently standing. So he's got to have better quality care. So yes, he's got to move. Okay, how am I going to move him to best take care of his feet? So the one thing is if he's shod, you need to put some kind of putty in there so that you've almost made a dome on the bottom of the foot, so that the wall is not the primary weight-bearing structure in the trailer. You know, some kind of you know, a lot of pads. The shavings alone is probably not enough. Could fill your trailer with sand. That might be better than just a hard flat trailer floor. Sand would be much better. Yeah, I mean, you may talk to your local veterinarian about, you got any ideas about how I can help support this horse's feet while I haul him. There's a lot of boots on the market. You can get hoof boots, big, you know, padded hoof boots. Put them in those so that they're not just banging down the road. What you don't want is this horse bouncing down the road, and the only thing he's standing on is that perimeter horseshoe on a hard trailer floor. That's going to do quite a bit of damage.
Yeah,
potentially.
We have a question here about insulin resistance again. So the question is, a horse that has insulin resistance and Cushing's, would it be not safe for them to be barefoot?
Not safe.
Are you suggesting that they don't go barefoot? Probably not in the middle of an episode where that's not the time to make the transition from shoes to barefoot, right? If they're very, very painful.
Well, see, that paper that we did was insulin resistant horses. And then we applied that same technique to some Cushing's horses, and it works on them also. So you do need to get the ground reaction force off of the wall on those horses, and you need to support them from the center. So if they were in a perimeter fit horseshoe, I would get it off, and I would put them in thick padded hoof boots. And the best boot is a boot called a soft ride boot. And the problem with the soft ride boot, though, is the pad that's in it. It's not the best pad. The best pad comes from a place called Rood and Riddle Equine Hospital, where they sell these big black circular pieces of human wrestling mat. It's the same mat that humans wrestle on. And it's about that thick. It's about, 2 inches thick. And you put it in that boot, and you put that on this insulin resistant horse. So I would not leave him in the perimeter shoe if he was insulin resistant and laminitic, if he was in my care. So because I don't want to further pull on that wall.
Right. I have a question from Vicky, and she asked this a while back. Do you have any pictures of like the growth rings? I think what she's asking is, show us what is not right. Show us what an unhealthy foot looks like with those growth rings, where we need to get our vet and farrier involved in some x-rays and things like that.
There might be some here. Am I sharing my screen again? There could be some in this down at the end.
I can't see your screen yet.
Okay, I got to figure out how to share it.
Should be that little green
Hang on a second. Let me see if these are right. Okay. I should have gotten that for you. I could get that and send it maybe. Hang on a minute. Let me see if I can figure out how to share again.
While she's working on that, Vicki, I see your question. Is this being recorded so you can share it with your vet and farrier? Yes, it is being recorded. We'll have it up on the Fauna website, and then I think it'll be on the Facebook page immediately.
This is a horse. I'm not sure if this is a horse that was at a former hoof clinic, but these are the kind of rings we're talking about. But we're talking about, and on this one, see, they're kind of this horse is in trouble from some sort. He's got such a long toe and an underrun heel, but these are the kind of bumps in the foot that we're looking at, but they would be wider at the back like this is. And then as you trace that same ring toward the front, it would be getting closer to the hairline. So if you have a growth ring that represents a point in time and you trace it around, and as you move toward the front, that thing goes toward the hairline. Not unlike this one. So see, this has growth rings, but they're all equal distance from the hairline. So they're not divergent. Divergent meaning that this ring would be at the hairline here, and as we went to the back, we'd end up here. Does that make sense?
Yeah, because the heels will be growing faster, right?
Faster at the heel than it is at the front.
Okay, great.
So I'm sorry I don't have a picture of that to show you at this moment. I guess common things you tend not to stick in there. Is there other questions?
Let's see. I'm looking. Supplements.
Yeah, I do have COVID.
Supplements for feet. Do we really need extra biotin? Is there a hoof supplement that you recommend?
Yeah, the biotin is often in your grain or feed, but you're not going to feed a fat founder horse grain. You got to get him off of grain. So that's a really good question, because if you're going to take him off of his grains, then where is he going to get his minerals? Okay, and so we believe that these horses often need copper, zinc, biotin, and the D-L-methionine. So we look for a supplement that has those four biggies in it. Okay, and we want to give fairly large volumes of copper and zinc. Okay, so the daily requirement from NRC for copper and zinc is like 80 milligrams for copper and 300 for zinc. But what we're seeing is that that's only if iron is not in excess in the diet. If you don't have excess iron in the diet, then this 80-30, 80-300 for a light bred horse is okay. The actual requirement for a Friesian, I'm not sure that's even published. How many milligrams do they need? Twice as much because they're almost twice as big? Potentially. They would need, 160 or 120 milligrams of copper a day and 300 of zinc. But again, that's only if they're not getting excess iron, because excess iron in some manner interferes with the uptake of copper, at least, and probably zinc. So the problem is a lot of hays have hidden iron in them. You don't know that there's extra iron in your grass and your hay, even though it's there, unless you test it. Okay, so in our area, we have a big excess of iron in our grasses and our forages. And so what we've done is just sort of give them extra copper and zinc, because copper and zinc aren't toxic to horses. You got to give a lot to ever make them sick. Okay, sheep and goats are sensitive to excess copper, but horses are not. Horses actually benefit from excess copper if in their diet, if they're got excess iron to go with it, so they can get enough copper absorbed. So we recommend, the short part of that is, we recommend a supplement that has, we usually use something that's got at least 200 to 250 milligrams of copper and 500 to 600 milligrams of zinc per day. And then you have your 20 milligrams of biotin a day. And so, yes, they do need the biotin, but I think they need this extra copper and zinc to go with it. And some of the companies, nutritional companies, are really not on board with that yet. The research has not really been done to show that given this extra copper and zinc is valuable. Now the ratios about the iron to copper zinc, that was all in the old NRC, National Research Council for Horses, Nutrition for Horses. It said in there that iron to copper was supposed to be no more than 4-to-1. And so, or 3-to-1. Sometimes they'll say 3-to-1, sometimes they'll say 4-to-1, but both of those are pretty close. The point is, most of the hays that these horses are eating, the iron to copper is anywhere from 21-to-1 to 8-to-1. It's never 4-to-1, you know, so that they would only need 80 milligrams of copper. It's always in excess, the iron is. So if you were to know everything your horse was eating, all the amount of iron he was getting in his hay, his grass, then you could figure out how much copper do I need to give in order to compensate and get my ratio back straightened out. Of course, the other thing about grasses is grasses are full of sugar. It's not just your feeds, right? So grasses are full of sugar. So
that was about the sugar in grasses at different times of the year, and is it helpful to have your horses in during the day and out at night if they're insulin resistant or have metabolic issues?
Okay, so when the sun gets on grass, it undergoes photosynthesis and it makes carbohydrate so that it can grow. So when the sun is on the grass and the grass has water, some water and some fertilization, it's going to start growing and making carbohydrate. And then tonight, if it's a warm night, it'll use that carbohydrate actually to do most of its growing actually at night, I shouldn't have said. So the grass mostly grows at night using the carbohydrate that it made during the day from photosynthesis. So by morning, on a warm night, by morning, there's not much carbohydrate left in the grass, okay? And then as the sun comes up, gets on it, the carbs start building, and so the carbs are peaking out in the afternoon. So grass with sun on it, that has had sun on it, is gonna have higher sugar than grass that's been through the dark, okay? So nighttime is less sugar. So like my horses that go out on grass, I mean, some of the people I run with think that I'm crazy because I let them eat grass, because they think that all grass is evil. It's got iron in it, it's got sugar in it, blah, blah. But the other side of that is horses that are on grass and drink from a natural water source colic less than horses that are stalled all the time on hay and stuff. So, and then I paid for a farm so that my horses could have hay, grass. I'm not going to go off now and buy a bunch of hay and put them all in dry lots, you know, because I'm smarter than I was when I bought the farm. But you have to do everything in moderation. So as long as what you're doing is not causing this horse to be obese and chronically obese, and you're getting nice linear growth rings that are the same width, you've got shiny hoof capsule coming that's not all chipped and broken, and you know it's shiny, it's projecting distally and not flaring, then you're getting away with whatever you're doing, you know, even if it's not perfect. But you can use, the other thing you can do to try to manage your grazing, you know, so I do managed grazing, what I call managed grazing. So my horses right now go out at night, the ones that I'm worried about being too fat. Some of them are out all the time, but the ones that are too fat only go out at night. Or they go out with a grazing muzzle. Grazing muzzles are a wonderful thing to use to try to keep, you know, minimize the intake. And then I give them these supplements that have high copper and zinc. So there's several of those out there. I don't want to, you know, sound like a salesman or anything, throwing out brands and stuff, but, you know, I just use the one, like the one I use, I think has 385 milligrams of copper and like 675 or something of zinc. It's got a lot, you know, it's got like 3 to 4 times what they're supposed to need on a day. But what's really cool is you get into some of these horses that, like, if their hair coat is burnt, these Friesians, if the ends of their mane is turned brown, then that could be an indication that you're mineral deficient. Okay, so they should be black and shiny even when the sun gets on them. Okay.
We have to have a whole webinar about that. People, I said we have to have a whole nother webinar about that. People are
and you need to do it with a nutritionist, not with me. I'm not a nutritionist, really.
I have a couple questions coming in here, so we're getting close to time, so I want to try and get to these quickly. Is Magna Wave detrimental or helpful to a horse in trying to prevent laminitis that has insulin resistance and Cushing's?
I have no idea. I don't know. I haven't seen that research that says either way. I don't know. I've never used it. I would just be making something up if I told you.
Are there any recommendations on the vitamin E levels in diet in relation to laminitis?
I don't think so. It's not considered one of the nutrients that's associated with laminitis, to my knowledge.
Okay, somebody wants to know the brands. I know what it is because that's what I give my horses now.
But the thing is that when you go and you get those minerals, I guess I feel rewarded by it from one horse I have. I have a dun mare that had really, really dry, brittle hair in the winter. You didn't want to touch her. Every hair on her was like a little J. It was like this little, you pull it off, it looks like a J. They call those J hooks. That's because your hair is burnt from the sun. And she had some hoof cracks. They weren't horrible, but she had some hoof cracks. So I put her on these super physiologic amounts of copper and zinc for about 4 years. And she turned so shiny and so dappled. Even eating my horrible iron-laden grass that's got sugar in it, she was eating that, but she still looks like so shiny. And, you know, her hooves are shiny. They don't have any growth rings. And so then I kind of ran out of effort and ran out of money and didn't give it for a year or so, but she still looks like that. So it's like when you're feeding it, you're thinking, my gosh, can I do this forever? It costs me so much money. But I think it seems to me on a clinical standpoint that this copper and zinc is accumulating in their body in a good way, the same way that iron accumulates in a likely, possibly a bad way. And so if you're constantly throwing copper and zinc at them, you're mitigating the negative effects of that iron. And it's long lasting. It's not just, even if you kind of back off a little later or feed a lower level later, you can maintain if you've put the effort in for a couple of years to get it in them.
So if you're wondering what the supplement is, Dr. Taylor didn't want to say it. I typed it in the chat box over there. You can go look at it. I feed it to my horse based on her recommendation. So, and it's
now that I learned the lady that makes that supplement, I wanted to talk to her today and I never did get to talk to her. My farrier that's working for me talked to her last week, and she has actually spoken with her PhD that helps her with her nutrients. And they think they've found something unique about Friesians and their need for copper. And I don't know, I wish I knew what that was and could tell you, but if you want to call her, I'm sure she would love to talk to one of you about it, and you could report back to the rest of the people about what she told you.
I'm getting texts now wanting to know what the supplement is. So I'm just going to say it out loud. And so disclaimer, so you use this at your own free will. And if it works for you, great. If it doesn't, great. Do your own research. But it's called Kiss Trace, K-I-S Trace. And it's made by a company called Thorn Bottom Farm. And that's spelled Thorne Bottom Farm. And they have a website. It's www.thornbottom.farm. So that might be something you want to look into. Maybe you have a good supplement, but she's giving you the amount. So if your supplement meets that ratio, then you should be good to go as well.
And then if you do get their supplement, they've got a new pellet that is more palatable. The horses like it better, and it doesn't fall out of the feed. They had a powdered one. Sometimes when these supplements are powdered, they've got so much copper in them, no matter who you buy them from, they're not that palatable. And the horse will just kind of move his lips around until it all sifts to the bottom, and they'll eat their feed off the top, and they'll leave the supplement in their feed pan. Yeah. So it's helpful when it's in a pellet, because then it gets mixed in with their other pellets and they can't get rid of it. I've never seen the pellets left in the bottom of the feed pan. I've only seen the powders left in the bottom of the feed pan.
So I have one question here, and I'll tell you all if you have Jason's got a question. Jason, you want to go ahead and ask that one?
Yeah, sure, Angie. Thank you. This is coming from our Facebook Live feed. So is there a way to find out what the mineral content is of the hay in our area? This individual's horses are in California and Nevada, and she's just curious.
Yeah, you get a hay, there's a sampler. It's called a hay core, and you hook it to a drill and you drill into multiple bales, and then you pull out and you have this little sample of a hay core sample. You put it in a baggie and you mix it all together after you've looked at multiple bales. And then I would send it to a place called Equine, which is a same company as Dairy One. They have the most data of anybody, any company. And I think that's where most of your big nutritionists send their samples. So send it to Equine. And on their website, they'll tell you exactly how to sample it. They may even sell you the hay core. You can't just grab handfuls of hay. You're supposed to have a hay core. It's like on a drill. It's like a big drill bit with a hole in the center you're going in and cutting out a section of hay.
So essentially, as we're getting our winter hay load, a lot of people have that in. They could get their hay tested, and then they could work with their nutritionist and exactly what.
The other thing is, if you're going to get your hay, if you're going to do that, get your winter hay load. Hay can have too much sugar in it too. Okay, and so if your horses are fat, or you think they're insulin resistant because they got lumpy, bumpy fat and all these signs, then they need to be on a low carbohydrate hay, and that needs to be less than 12% non-structural carbohydrate. Okay, and you can get that information from Dairy Equine also. And to determine the non-structural carbohydrate, you have to add together water-soluble carbohydrate plus starch on your hay report. You add those two together, and that percentage is your non-structural, NSC. And you want your NSC to probably be less than 12% for fat horses that you're trying to maintain or get less, get them to not be so fat. So less than 12% non-structural carbohydrate is what you want. Now your hay you buy may be much higher than that. If it is, you can soak it in water for 30 minutes before you feed it, and then feed the horses only hay that's been pre-soaked. The soaking takes some of the water-soluble carbohydrate out. Now throw the water away because that's the Kool-Aid. Okay, get rid of the water and feed the hay. And that'll help a lot. If you're struggling to get weight off of horses, they should be on soaked hay.
Okay. I have a question.
And anything that goes in their mouth needs to be less than 12% in non-structural carbohydrate.
Oh boy. Okay. That's very good information. So question of the general hay, so general types of hay like Bermuda, alfalfa, Timothy, etc. What's usually the least sugary?
Probably Bermuda, I would think. I mean, Bermuda doesn't have very many calories in it usually. Bermuda grass.
Don't live in the South, and they have things like Timothy or Orchard or alfalfa.
Okay, so the grass hays, everybody thinks grass hay, but grass hays can have a wide range of sugar, and it's based on the environmental conditions the day the hay was baled. Okay, so we didn't talk about what happens when you get freezes in the fall, like fall baled hay or spring baled hay. If it was baled while the weather was warm and sunny, but the night before it was cold, if you're getting cold nights, then that's causing the sugar to increase. When it's less than 45 degrees outside, the sugar is not used up overnight. So the next morning, you have all of yesterday's sugar. Now, if you're going to have another sunny day, now you've doubled the sugar almost. Now on that third day, somebody cuts the hay down, cuts the grass down and makes hay. Now that sugar that could be 2 days worth is locked in there forever in that hay. Okay, it's not going to go away because you stored it. It's going to stay in that hay forever. So it's got to do with what was going on with the weather and the temperatures right before the hay was baled. And there's a really cool website called safergrass.org. It's a lady named Katie Watts, and her whole career has been teaching people about this hay and grass and how to manage your hays and grasses so that your horses don't eat so much sugar. So I would say go to her website or do a webinar with her. She would love to talk to y'all. It's called safergrass.org is her website. And she's in Colorado, but I'm sure she can apply, her knowledge to many areas.
Okay, I have a question here, and I'm gonna put out to the audience on Facebook or here on the webinar. Final call for questions, please, because we're at about an hour and 15 minutes. So question is, if I have a horse that is prone to being overweight but is in hard work is it safer to feed it fats before carbohydrates?
Safer to feed it fats instead of carbohydrates?
I think they're asking, would it be safer to go with, adding something like oil to like a ration balancer, or should they bump up to a heavier feed that has more calories in it?
Because this is a horse that has a tendency to be fat, but he's in work and needs the energy for work.
You don't want him to get underweight and out of condition while he's in heavy work.
Okay, so I'm gonna tell you what I would do, but there's a lot of nutritionists that think this is wrong. But I would feed that horse alfalfa. Okay, because alfalfa, if you go on Equine Analytical's website, the range on sugar on alfalfa on non-structured carbohydrate only goes up to about 14. The range on grass hays can go as high as 20, 22, 25 or something. So I wouldn't feed the horse straight alfalfa, but I would supplement him with the protein that's in alfalfa. Now, alfalfa is high in non-fiber carbs, but it's not that high in non-structural carbs. It's high in protein. It's high in non-fiber carbs. Non-fiber carbs are made up of pectins. And as I understand it, pectins can help with insulin resistance even. Now, having said that, there's a bunch of nutritionists out there that thinks alfalfa is not good. But that would be what I would feed a horse in work. And that's actually what I feed some of my laminitis rehab cases that get too thin in the end. When they start to get too thin and we're having trouble catching back up, we use beet pulp and some alfalfa.
So the old adage of forage first, I guess.
Yeah, forage first, right. Mm-hmm.
And perennial,
forage.
You're in the South, perennial peanut would be around the same.
Similar, it's going to be a little higher sugar. It's a similar protein content. I love that hay, but it will put some weight on one. And they better be in work when you feed it to them, or they will get overweight. So I would prefer alfalfa over perennial peanut just because it has a lower NSC, I think. Okay. From the hays, I haven't seen just go to Equine Analytical's website and look at the averages. They have averages for hundreds of thousands of hays of all different types. And the thing that stood out to me when I did that was the narrow range on alfalfa. It's not perfect. Some of it's 14% or 15%, but it didn't go to 22 like some of your grass hays do, baled in certain environmental conditions. Grass hay can be very much full of sugar.
Okay, well, I don't see any more questions. So I want to thank you, Dr. Taylor. I think we learned a lot. I hope everybody that was listening got some clues and tips about maybe look a little closer at your horse's body weight condition and see if maybe you need to dial things in before you have an episode that creeps up of laminitis, and also be watching out for those changes of the hoof wall, looking for those growth rings. Get a baseline set of radiographs. If you see something doesn't look right or your horse is looking sore, time to get the farrier and vet involved immediately.
Right, yeah.
So prevention really can be the key here. And then if you have a acute case or a fever or carbohydrate overload, get your vet and farrier involved immediately, especially before you do anything like move the horse. Get your team together, come up with a plan on how and where to best treat that horse.
Right.
Okay, great. Well, thanks so much, everybody out there on Facebook and at the webinar here live. We really enjoyed this, Dr. Taylor. I hope it's going to hopefully save some owners and some heartache and some bills. So
so if you've got a hunter in your life, this is the time of year. Tell them, do not be leaving that corn in the back of your pickup in my driveway.
Good tip.
Lock door. Feed room door locks. That's a good way to prevent laminitis. Yeah. A lock on your feed room door, because your horse might get out and then be banging on the feed room door.
I think I've known more than one people that's happened to. So.
All right. So find yourself a padlock of some kind or a chain to put on the feed room door.
Wait, is there one more question here? Okay, everybody just is saying that this has been very helpful and they really appreciate it so much. So thank you, Dr. Taylor. With that,
okay. Thank you.
See you guys on the next webinar, and thank you to our sponsor, the Fenway Foundation for Friesian Horses.
All right. Good night.
Good night.